Well, I'm sure by now you'd all know our love for the calf muscles as the most important muscle for runners. We certainly can't discount the importance of the hip muscles, and in particular, the lateral hip muscles. So what function do these glutes serve in runners? In this video, we're going to look at the lateral hip muscles, which are the muscle group on the outside of the hip and include the glute medius, the glute minimus, and the tensor fascia latae, or the TFL. In running, the primary function of the lateral hip muscles is to stabilise the hip joint throughout the gait cycle. Upon foot strike, the glute medius acts eccentrically to control hip abduction, and from then midstance to propulsion acts concentrically to create hip abduction. Faster speeds have been shown to increase the demand on the lateral hip muscles. Most people think that the glute max is the most important hip muscle for runners, but from Lenhart's study we see the glute medius performing 4 times body weight of force compared to the glute max, which only approaches 0.38 of body weight force. The glute minimus also assists in stabilising the hip and is mainly active during the early and late stance phases of gait. What are the consequences of weak lateral hip muscles? Weakness of the lateral hip muscles has been implicated in both poor running economy and could also increase peak impact vertical ground reaction forces during running and result in the impaired ability to absorb forces. Regarding injury, from the literature we see a 28 and 21% loss of hip abduction strength in women with patellofemoral pain, 20% weakness in those with femoroacetabular impingement, 30% loss in those with greater trochanteric pain syndrome, glute medius weakness also seen in those with low back pain, and athletes unable to generate 35% of body weight were significantly more likely to sustain a non-contact ACL injury. Recently, there's also been some studies looking at the rate of force development and injury, and Ferreira in their study found that women with patellofemoral pain have a 30% loss in hip abduction rate of force development, and similarly, Nunes found those with patellofemoral pain had a 31% loss in hip abduction and 29% loss in hip extension rate of force development.